Okay, Patty, thanks for agreeing to talk about this. So you're going to share just a little bit about the population that you work with, some of these special populations. Since you have experience, it's great to get firsthand experience. So tell us a little bit about what you do.
Yeah, so a lot of my clients are first or second generation, typically Spanish speakers or speak Spanish as a second language. And so I think the biggest thing when it comes to the clients that I work with is just acknowledging that language, because it doesn't necessarily have to be Spanish. It could be a special dialect that they also use or speak within their family. So when I'm doing the biopsychosocial, I'm bringing in language, especially because there's different nuances depending on the word that they're saying. So I really like to keep that in mind. I think it's a really good way to be able to align with the client when I can understand what they're talking about,
Mhm.
or I can relate to some of the experiences, some of the traditions, which goes into like the other piece that I keep in mind, the traditions. Oftentimes, certain holidays are celebrated in very specific ways. Um, and I think it's really important to just stay open-minded if you're working with the Latinx population, because there might be different traditions or, types of food or experiences that are normal for us
Mhm.
that maybe for other people might not seem so normal.
Huh.
Um, and so whenever you are working with this population, the biggest thing is, being open-minded, especially because stigma is so big within the Latinx culture. We're really big on kind of keeping our secrets under wraps, not sharing
Mhm.
family secrets. And because of that, if there is this underlying like judgment or shame that may come up, then I imagine that the clients might kind of like not want to share more for fear that they'll be judged or there'll be some shame that might come up.
Mhm.
And so really like understanding the cultural aspect, language, food, traditions is really, really important to be able to have a really strong therapeutic alliance. Now, with that, oftentimes there's certain things that are also used. So, for example, there's specific kind of blankets that may be used that a client might bring into session.
Okay.
And this is like a way to be able to like wrap ourselves, wrap our bodies as a form of safety. And so being open to that. Also sage, is a big one as like we use it for many different reasons. And so kind of bringing like oftentimes clients will lean into some of these practices as
Mhm.
a way to self-soothe. And so again, like either doing your own research or just asking questions, being curious,
Okay.
can go a really long way.
Is there any, I'm just thinking for working with the Latinx population, is there any common like negative cognition, negative beliefs that you see in your work?
Yeah, I think the guilt and shame really are present in the Latinx population, in the Latinx culture. And that usually comes from this generational trauma that
Mhm.
is really um, present. And that comes from this, if I'm not taking care of my family, then what does that say about me as a daughter, as a member of the family? If I am not, if I am not doing certain things, if I'm not
Mhm.
having the American dream, then what does that say about me as a person? So guilt and shame, I think, are big things that are really, really present. So the I'm not good enough, I'm worthless, I'm inadequate,
Uh-huh.
everything surrounding the worthiness
Okay.
category, and also the piece on responsibility.
Ah, that
And
makes
then
sense.
choose two, responsibility and worthiness are the two main ones that I see often in my work.
Okay. And lastly, I guess I would ask, like, for clinicians maybe who are not part of the Latinx community but work with people who are within the Latinx community thinking about doing EMDR, is there any recommendations you might have for training or resources or things that can help them be more confident and culturally competent in working with this population?
Um, I'm sure there's a few books out there that if I think of one in specific, I can put it in the chat. But my biggest thing is always asking questions instead of
Mhm.
assuming
Okay.
that that something is a certain way. Be curious.
Okay.
even me, like I don't know everything about everything,
Mhm.
but being curious even about my own people, my own culture, really brings in this piece of like I want to know because I want to be respectful, and I want to kind of meet you where you're at. So being curious, I think, goes a long way.
Yeah, and I think too, sometimes like even for African Americans, sometimes I would get when I worked in community mental health, they would give me the African American clients because we're both African American, but I'm Southern Black. That's different from Midwest or up North. There's a lot of differences, and also how you're raised, whether it's single parent, married parents, or I was raised in poverty. It looks quite different. So even though we may have the same skin tone, the same racial background, we're not all the same. So I think kind of the same thing is what you're saying there.
Yeah, absolutely. I mean, like, so I'm from Mexico, and Mexico is just one country
Yep.
out of many Latin American countries. And so even the way that we speak, compared to the way other countries speak is different. The way the food, even like northern versus southern Mexico is very different. And so being curious, like I said, I think goes a long way.
Awesome. Well, thank you for sharing your knowledge, Patty. We appreciate that.